What I worry about is there are about 680,000 veterans in the state of North Carolina, and they receive every year north of $4 billion in treatment through the VA. This is a state where we've seen multiple cuts, both to hospitals and to inpatient bed capacity. It's a problem that's not getting better, and it's a problem that will get significantly worse if we see major cuts to VA staffing.
North Carolina is known as the most military-friendly state in the country, home to over 600,000 veterans, nearly 100,000 active-duty soldiers, and 10 major military bases.
A delay in care for a veteran could be the difference between life and death. A delay in care could mean that a veteran would be diagnosed with cancer at stage 4, where the treatment options are limited.
As a VA surgeon and now a public health advocate, Dr. Kyle Horton of Wilmington has seen the personal battles that veterans fight each day.
And I had patients who attempted while they were awaiting getting integrated into mental health care. And when you've nearly lost patients in that way, it's heartbreaking.
While veterans primarily rely on the VA for care, in recent years, around 10% of veterans are also enrolled in Medicaid. Cuts to Medicaid at the federal level could impact veterans.
One of the misconceptions about the VA system is that it treats all veterans, right? And the reality of it is that the VA system treats only service-connected disabilities for folks that are under a certain disability threshold. And so a lot of people that are veterans, they're in the regular healthcare system like everybody else. These aren't people who aren't working or not doing anything. It's critically important for people that have jobs and just aren't able to pay the really high healthcare costs that we're seeing in the world today.
In recent months, there has been a groundswell of grassroots protests and rallies in opposition to cuts to veteran services. Dr. Horton says that it's not too late to stop these cuts and urges North Carolinians to call their senators and members of Congress to express their opposition.
Let them know that veterans and military families are paying attention to what they're doing, that you are paying attention to what they're doing, and we'll hold them accountable at the ballot box. You can call the Capitol switchboard. They log your calls. It's 202-224-3121 to get through to your reps. That's the one thing the congressional reps pay attention to each week. They'll get a report on who's calling about what issues. Let them know veterans and military families are top of mind for you and a priority, period.